As a first presenter, first presentation, we are going to listen to Ms. Aparna Mittal. The topic, Rare Diseases and Rehabilitation, a lived experience perspective. Ms. Aparna is the CEO and founder of Patients Engage, a social enterprise and online platform based in Singapore and India for patients dealing with chronic disease and their caregivers to share personal experiences, information, and to learn from each other. It also encourages people to make preventive health choices. Over to you, Aparna.
Yeah, as Meenakshi said, I will be sharing some of the, what we've learned based on experiences shared by various people with rare diseases. A quick recap on Patients Engage. And why I guess I've been invited to speak. Patients Engage is an online platform for patients dealing with chronic diseases, including rare diseases, as well as their caregivers, to share personal experiences, information, and learn from each other. Our basic objective is that the lived experiences are an important source of information for people managing chronic disease, and they complement and are equally important to the medical information or the information by other healthcare professionals. We also believe we've been engaging with communities and patients and caregivers and laypersons over the last 10 years. And we've given equal weightage to lived expertise by lived experience as well as healthcare professionals. And we do believe that, being better informed makes people make better choices and confidently engage with stakeholders. So that's kind of the primary objective, the inform, engage, empower, why we focus on lived experience. What we found in talking and speaking with various people with rare diseases and the various communities that are out there for the different conditions is, if you look at the journey of and for the sign language interpreters, if I'm going too fast, please let me know. So rare disease management is complicated. It's filled with uncertainty. And at various stages, right, the diagnosis process often takes very long, especially in low resource countries. And, everything is far away. Everything is limited to certain centers of excellence and tertiary care centers, and people need to navigate to those places to find answers. And even then, it's not easy. So typically, we've found that it takes decades for people to get to a diagnosis. And even after they've got to a diagnosis, they struggle to find the right care team. It's a constant evolution of the team. It keeps evolving over time and most of the rare diseases still do not have treatment options. So they're still struggling with management of the condition without, clear treatment guidelines. They are unclear on what sources to trust, who they can speak with, and even in terms of how do you engage with the medical professions, right? So what questions should we ask? What are the answers that will help me make the quality of life of the person living with the rare disease better? There's also various cost implications. There are familial implications, especially because a fair number of rare diseases are genetic and inherited as well. So there is this concern about whether they should share with family and friends. Do they ask for help, not ask for help? Plus, in most countries, there is no coverage for financially for rare diseases, or it's very limited. So that continues to be a big challenge. Wherever treatment options exist, most of them are extremely expensive, and even rehabilitative costs and supportive care costs can be high. So what we found is, and this is a simplified synopsis, but people obviously need better information to be able to know what to expect. They want to connect to, they want to access other people with lived experience. And we've sometimes shared experiences which are so unique and rare because they want somebody else to benefit from it, so that, they're not struggling just as much as, others are not struggling just as much as they did. And the biggest challenge continues to be access to optimal care. How do you navigate the health system rather than just struggling with answers? So we'll take a couple of examples to kind of illustrate the point. There's a young woman with rare autosomal disorder, 23 years old, lives in a tier 1 city in India. It took 10 years to get to a diagnosis, and she's been living with the condition for 7 years after the diagnosis. And, as her mother says, that they've focused, the attention to physical and mental well-being. And because I've focused this presentation on rehabilitation, we focused on those elements. So the attention to physical and mental well-being has been continuous in our journey. Be it speech therapy, alternate therapies, like they've tried everything: acupressure, acupuncture, Ayurvedic massages, psychotherapy, Reiki, pranic healing, everything possible that was out there that anybody suggested, they've tried it. They've also, because they could afford to, and because they could make, kind of set aside funds for it, they even learned therapies from an institution in the US, tried a home program. And they themselves learned it and converted their home into a rehab center so that the child could function better on a day-to-day basis. She could improve her quality of life. And similarly, there's a young man with SMA, 33 years of age. Again, 10 plus years to a diagnosis, has been living for 20 years after that. And he admits, he shares that he has limited use of his limbs, and the severe scoliosis of back causes unbearable pain in my muscles all over the body. Additionally, the spinal muscular atrophy has affected my breathing abilities, and the pain keeps me up at the entire night. So that's the kind of impact the rare disease has on the quality of life. And so what does he do? I try to take care of myself to the best of my ability. As a wheelchair user, I live a fairly sedentary lifestyle, so I take extreme precautions to try to avoid putting on weight. And physiotherapy is, part of my life, as I need to preserve whatever muscle strength I'm left with. So massages and stretching exercises are a regular part of my daily routine. And these are a couple of illustrations, but it shows how even for rare diseases, there is a constant need for rehabilitative and supportive care. And what we find is that often people do not know about these. They're not guided towards it from, by healthcare professionals. And because diagnosis itself is late, the first few years till they get a diagnosis, they're just trying out things. It's like, significant amount of trial and error as to what's working, what's not working. So the quality of care that they're receiving is a struggle. And as you can see, it continues to be largely home-based, a mix of, home-based and professional care. So that was what we kind of, when we summarize some of, not just these two, but others that we spoke with, is that access to regular supportive and professional rehab care is challenging, both from access from a distance point of view, from a cost point of view, and time toxicity as well. Pretty much everybody said they use a mix of professionals and family support. Finding the right skill set is often a challenge because there are very few professionals out there who understand the nuances of some of these or most of these conditions. There's always this constant worry that parents have if they're pushing their child too much when they try and do it on their own. And time and again, we find that there are no clear protocols for rehab even after a diagnosis. Thanks. So the care team and the associated costs, keep increasing over time. I'll give one example of how somebody who reached out to us, she's got a rare connective tissue condition, 60 years, tier 1 city, 10 plus years since diagnosis. As the condition progressed and affected various organizations, her quality of life kept deteriorating. And, she was also a primary caregiver to her elderly mother-in-law. Constantly navigating priorities was very tough on her husband and children. So we counseled her on the importance of pulmonary rehabilitation. We shared articles from our website on that, connected her and her husband to a couple of support groups. And during COVID especially, we connected her to online rehabilitation services. And fortunately, she stayed strong enough to be able to wait and cope with a lung transplant. So, that's one of the ways, or some of the ways, that we connect people and we help them find solutions. So as I said, the key thing always is for them to be better informed, to be able to engage with others with similar lived experiences, and to feel empowered in terms of making decision making. And what they need is, they really do need better protocols and referral system to be able to get effective supportive care and rehabilitation. We need models which make these services accessible locally. And I continue to be a strong believer of lived experiences and the need to leverage them, not just for information to other patients, but for defining care guidelines. And all of this will result in better quality of life. So I think that kind of summarizes what we really continue to believe, that no one should have to deal with their condition alone. And you can find more about us on our website and social media. Thanks.
Thanks, Aparna. The key takeaway of go local, that is living in the community and have the services of the community, and also to be informed, is a key message that most of us miss in terms of, accessing the first point of contact and getting to, living the life, which we miss otherwise. Yeah. Thank you, Aparna, for that.